Welcome, everyone. I'm excited that you've joined us. My name is Abby Cohen, and I'm the Region 9 State System Specialist of the Child Care State System Specialist Network, a service of the Office of Child Care, and I'll be moderating the webinar. Let me turn it over to Lori Sommerfeld, who's first going to walk you through some technology logistics.
Hello, everyone. First, I wanted to mention that this meeting is being recorded, so I just wanted to make you aware of that. But because you're listening to this through your phone, you will not hear your lovely voices today. Just a note that for today's webinar, there is no call-in option. The webinar is being broadcast through your computer speakers, and so hopefully everyone can hear me right now. If you have questions for the presenters about the topics discussed, please write a question in the Q&A pod that's in the top center of your screen. These questions will be compiled and we will follow up after the webinar. If you have general comments, or immediate needs, they can be entered into the chat pod at the bottom middle of your screen. Unfortunately, on a webinar with this large of an audience, we are unable to do much by way of troubleshooting for individual participants. Please keep in mind that if you are experiencing trouble with your technology, a recording of this webinar will be sent around to all who registered after the webinar. And now I'm going to go ahead and pass this back to Abby so we can get started.
Thank you very much. As you see, that is me, and I'm going to move this forward and start the series overview. I want to welcome you to the Emergency Preparedness and Response Plan series. This series represents the work of many states across the country and the assistance of many people to get this to us today. There are 6 webinars that form the series and will help states develop a Emergency Preparedness Plan as framed by OCC's framework. The series was developed in recognition of and with sensitivity to the complexity of the topic, acknowledging not only the multiple systems that stakeholders that have to be considered, but also the emotional response that this topic triggers with people. This particular webinar is on coordination with key partners and emergency management agencies. Our speakers will include federal government and state officials as well as national experts, and we've designed it so that states can choose sessions depending on their interests and needs. States that have emergency preparedness as a TA goal are strongly encouraged to participate in all the sessions. Participants will be asked to interact via the chat, polling, and question and answer box, and the webinar and resources will be archived. I want to say that future webinars will be much more interactive, but it was necessary for us to make this one a little bit less so that we could get some basic information, some foundational pieces out, and we don't have that much time. Please be aware that technical assistance is available, and you can get that technical assistance through the State Systems Specialist Network in collaboration with CC10 partners and regional offices. As Lori mentioned, all the lines are muted in order to provide the best audio experience for all the participants. And the questions that you submit will be compiled and answered after each of the sessions. We just simply don't have enough time to go through a typical Q&A. And also, once again, the webinars will be recorded and transcribed and archived as resources. So let's move on to today's agenda. We hope to explain the information memorandum released in 2011, which has also been provided as a resource. The webinar series will expand on this framework based on states' experiences. We'll be providing an overview of the CCDF Agency Emergency Preparedness Planning Tool, coordination with key partners, and then we'll hear from Washington State as they discuss their inclusive planning process. And we'll also be hearing from New York, which will describe its process of geo-mapping and how this was used, as well as focusing attention on developing communication, information sharing, and reporting protocols throughout the stages of preparedness, emergency, response, and recovery. Finally, New York will briefly touch on the development of a Children's Issues Task Force and its functions. But this topic will be fully explored in the last webinar of our series, Recovering, Responding to Trauma. So we want to find out who's on our call with us today. From the series registration, we know that participants on today's webinar may be including state administrators as well as other state staff. Local and community as well as regional, national organizations are also represented. We know from the registration process that we have 43 states and territories represented with approximately 200 participants on today's call. We're going to complete a quick poll to see who may be participating in the session. The question is posted on the screen. Who's with us today? You can respond using the Adobe polling function by clicking on the answer that best describes you. After a short time to allow for the responses, we'll close the poll and broadcast the results. Well, the numbers are still going, and we're seeing lots of people who are state administrators and staff, and also quite a number of child care resource and referral agencies. But we'll wait until the poll has completed. Lori, do I end it or do you?
Go ahead and end it.
Okay. All right, so we have an overwhelming number of state administrators and staff from a variety of state agencies. We also have a very small number of county administrators and staff. We have fire, building, and health and safety officials, child care resource and referral agencies, training and TA providers, regional offices, and several others of you. Okay, I'm going to move on now to introduce to you Amy Spates. Amy serves as the program specialist. Actually, I wanted to introduce to you all the people who will be speaking in addition to myself, and that is Amy Spates, and prior to her going on, I'll further introduce her, as well as Louisa Swanson and Sally Regal from Washington State, as well as Janice Molnar and Dan Tatro of New York. And all of their biographies will be sent to you following the webinar. I'm going to talk to you now about, I want to set the stage for our discussion by highlighting some of the personal emergencies that I've been through. I would bet most of you have been through an emergency or two. I've been through more than my fair share, but the good news is that I've never been injured, though I have at times experienced a great deal of fear. I'm going to swiftly move through this series of slides, but highlight a few which exemplify some key issues we want to raise up for your attention. Hurricane Donna occurred when I was a small child, and I remember our neighbor's weeping willow tree picking up their entire lawn and it toppling on our garage and damaging it. The biggest concern, though, was flooding, and this is the most common natural disaster in America, flooding. The next slide shows the 1965 hepatitis A outbreak that occurred in New York. The slide represents a hepatitis A outbreak I experienced in Valley Stream, New York when I was in elementary school. This was a public health disaster at the local level where emergencies and disasters always begin. An infected food service worker, the owner of the town's most popular deli, shared the disease by making sandwiches, and 90 residents were infected. I remember receiving a gamma globulin injection with my classmates at school as a prophylactic to prevent all of us from getting sick. For some of you on the East Coast who are old enough to remember, you may recall the big blackout of 1965 impacting the entire Northeast. For those of you who are younger, you may recall the blackout of the Northeast and parts of the Midwest in 2003. Consider that with our growing dependence on technology, problems with utilities and the grid can be disasters at the local, regional, or national levels and be caused by man or by natural events. Man-made disasters, especially through violence, have become increasingly common. Here you see the 1967 Newark riots in New Jersey. My father worked in Newark in 1967. 26 people died and hundreds were injured in these riots. Here is another natural disaster, the 1978 Northeastern blizzard. I was in Rhode Island. I had the luxury of enjoying being in college and having classes canceled, but for others, they had to abandon their cars on I-95, which shut down after a record 27.6 inches of snow. This blizzard across New England killed 100 people, injured 4,500, and caused $520 million in damage, and that would now be the equivalent of $1.88 billion. I moved to California in 1978 and once again experienced man-made violence caused by a protest upon Dan White's conviction for manslaughter rather than murder for the assassination of San Francisco's Mayor Moscone. I was in an adjacent building going to the law school there, and the riots took place in City Hall, which was next door. I was in lockdown while cars were torched and rolled. Another instance of man-made violence occurred when I worked in a high-rise. A man came to deliver what was thought to be long-stem roses. It turned out to be a shotgun he used to kill his ex-wife. He killed 3 people several floors below mine. We were told over the office's public address system to lock ourselves in our offices until we received an all-clear notice. 7 years later, another natural disaster occurred, a major earthquake registering 6.9 on the Richter scale. 63 people died in Northern California. 3,757 people were injured. Only 2 years later, I had moved to Oakland and after purchasing a home, packed up, ready to flee. The fire was stopped short of my home, but it killed 25 people, injured 150, and burned 3,354 single-family homes and 437 apartment buildings to the ground. Fire is the second most common disaster in America after flooding, with some being very localized, even one building, while other wildfires cover huge swaths of ground. Finally, 2 years ago, I was in Honolulu for an on-site TA visit when an emergency occurred, a tsunami warning. We happily escaped anything major, but it suddenly brought into sharp focus the unique issues of experiencing an emergency far from home, away from family, away from a familiar community. I was unfamiliar with my location, what specifically to do in that type of disaster, and I was definitely far more dependent on Honolulu to inform me of what to do, and I give them very high marks for doing so. I listened to my hotel's instructions and watched very informative TV news in which public officials and scientists addressed the audience. So, many of you have been through at least one disaster, whether natural, public health, or man-made. I want you to think about what you have been through, and think, too, that disasters are increasing in frequency and severity worldwide. I know you're probably thinking, I'm going to stay away from that woman, but I do want to remind you that everyone has the potential of facing an emergency. In terms of where we are as a country, we have looked at the status of the state emergency preparedness plans across the country for CCDF. 7 registrants said their state EPR plan was fully implemented. 15 registrants said theirs was developed. 27 said that it was in revision, and the rest said that either they were planning it or they didn't respond. When I reviewed plans several years ago, what I found was that many of the states who said, yes, they had a plan, in fact, did not have a comprehensive plan. Some of them had continuity of operations plans for their own agency. Some of them answered yes, when in fact all they really had were requirements, licensing requirements, that were imposed on their providers. And then other states said that yes, they had a plan, when the plan they were referring to was their state emergency plan at the state level for multi-hazards. It was not a child care statewide emergency plan. Now I'm going to introduce to you Amy Spates. And Amy is from our regional office in the Region 1. She is a program specialist working with the New England states and tribes around the administration of their Child Care and Development Fund block grant and their technical assistance needs to support increasing access to and quality of child care for low-income families. Previously, Ms. Spates held the position of Regional Emergency Management Specialist for the Administration for Children and Families in Region 1, supporting ACF grantees, local and state agencies, and other federal agencies in addressing human services issues in emergency planning, response, and recovery. Now you'll hear from Amy.
Thank you, Abby, and good morning, everyone. All of you are on this call because you realize the importance of planning for emergencies for child care. And some of the specific reasons I wanted to mention include that planning minimizes the likelihood of injuries and death of children, and children are particularly vulnerable in a disaster situation. Preparation can minimize the psychological impact of a disaster. Planning and preparation can reduce revenue loss and provider liability. And child care, as you all know, is a vital service to the community. So the faster we get child care back up and running and recovery, the better off the community is. And also, the National Commission on Children and Disasters had supported lead agencies having child care emergency plans in their 2010 report to Congress. Back in early 2011, the Office of Child Care disseminated an information memorandum to child care lead agencies, providing a framework for the lead agencies to use in developing their plans. We developed this framework, this guidance, with the goal in mind that each lead agency would develop and maintain a written comprehensive multi-hazard plan to address emergency preparedness, response, and recovery efforts. So as Abby referred to, we found that some lead agencies thought that they had plans, but they were more their overall state agency COOP plans. And so we really wanted states to focus on child care specifically. And so we created this guidance to assist states and tribes in the development of these plans. We feel that the guidance recognizes the importance of disaster preparedness to protect the health and safety of children and the role that child care plays in assisting families and communities in recovery. And it was developed in partnership with FEMA, with the National Commission on Children and Disasters, Save the Children, other non-governmental organizations, and possibly many of you on this call as well had a hand in supporting us and giving us guidance around this framework. So the framework has 5 key components. I'm going to go over them individually as briefly as possible. The first component is planning for continuation of services to CCDF families. The most important thing needs to happen is making sure the CCDF program continues. Grantees should have provisions for ensuring that core functions of CCDF continue, such as payments to providers, extending eligibility redetermination, or maybe changing documentation requirements for those in the impacted areas, and licensing and regulatory oversight. Your plans and policies should also address how to prepare for and assist new enrollees who suddenly qualify for CCDF services, who may not have qualified before, as well as how impacted families might be prioritized for services, how you might modify your eligibility criteria, what policies are in place to perhaps implement a wait list, and how families needing assistance would be identified and tracked. Also should be a communication plan that should include protocols for strategic communications, decision-making, and how you're going to share information. Regarding data and storage, grantees really should ensure the safety of client information. Having backup is really important for data, emergency backup, and things like that. I wanted just to note that this particular topic on subsidy and licensing regulatory systems is very complex, and so it's going to be covered in a future webinar, as Abby had referred to. Coordinating with key partners is as important in emergency planning as it is in any of the work that you all do. And some of the partners that should be particularly partnerships that should be developed regarding emergencies are with the state emergency management agencies, such as your public health officials, public safety, et cetera. They can provide consultation as you develop your plan, but can also be key sources of information during an emergency or a disaster. Voluntary agencies, state agencies, your Department of Ed, Social Services, as well as the Head Start Collaboration Office, pre-K, and other early care and education settings. Now this is particularly important in communities that provide before and after school and summer care within a school facility. So you want to work with those partners to ensure that your plans are consistent and complement each other. Volunteer agencies include, we've talked about Save the Children, the American Red Cross. They can provide training. They could provide assistance with support for temporary and respite care services following a disaster. CCR&Rs can also be helpful with training, disseminating information. And contractors and businesses are could also be crucial partners, and as they could help you with additional staffing and supplies. And I want to just say these partnerships are really important and should really take place and be formed in the planning stage. It's not after a disaster happens, it's not the best time to introduce yourself. So you really want to get these partnerships in place as you're in your planning process. Third, consideration should be given to regulations and assistance for providers to develop plans and to communicate them through orientation of staff and families and practice through drills. You should coordinate with licensing agencies and looking at how well do your licensing and regulatory requirements address emergency preparedness. And there's lots of guidance available around this. Child Care Aware, Save the Children, Caring for Our Children, National Standards. You'd be able to find some really good information there. Again, the CCR&Rs, they can help with developing a communication plan, assist in reunification efforts, and also in assessing the impact of a disaster. This is another topic that's going to be discussed in a couple of future webinars. So provision of temporary child care. This requires that you coordinate with your emergency management agencies, your VOADs, your CC&Rs. Again, we're referring to these folks a lot. You might want to consider pre-event agreements or MOUs, outlining roles and responsibilities, who will do what in the event of a disaster, and planning for temporary respite care. Should also, when you're thinking about temporary care, keep in mind the needs of first responders who might need child care as well. Temporary operating standards that ensure that regulations are not a barrier to providing services, maybe provisional licenses to cover parameters such as access to electricity, access to water source, and plans should address identifying and training of pre-approved child care providers, because remember that child care staff themselves may also be affected by an event and unable to report to work. So you need to develop policies that sort of think of a larger pool of on-call staff, so to speak, and considering training, background checks, how can background checks be expedited, and finally, rebuilding child care after a disaster. As we talked about, child care is such a critical service to a community, and so making sure that the repair and recovery of child care facilities happens quickly, or as quickly as possible, so that parents can return to work, and child care and children are returned to a more stable routine. Lead agencies, it's important to develop strategies for educating and training providers to ensure business continuity. You know, do providers have adequate insurance coverage? Your assets protected? Protecting your vital records like bank accounts and your insurance policies, service agreements, and be prepared to provide these folks with information on financial assistance, such as through the SBA, which is the Small Business Administration's Disaster Assistance Loan Program, FEMA, and also other nonprofits, and potential use of your CCDF quality funds is something to keep in mind. And this, again, will come up, some of this will come up in another webinar later on in the series. So back in March of 2013, to really underscore the importance of child care preparedness for disasters and emergencies, and just to, again, affirm the high priority the child care is for both FEMA and for ACF, the ACF Acting Assistant Secretary and the FEMA Administrator sent out a joint letter to governors, and state administrators were all sent a copy as well. And again, also just to acknowledge the tremendous work that state agencies have done in this area in the last few years. And lastly, many of you in the state agencies are aware that the Office of Child Care has proposed revisions to our rules, and related to emergency preparedness. If those rules were to be implemented, were to be finalized, they would include requiring new child care providers, child care lead agencies to coordinate with agencies such as licensing, Head Start, and emergency management agencies. It would also require that CCDF providers be trained in emergency preparedness and response procedures. So stay tuned for that. That is still in the not final stage. Thank you.
Okay. This is Abby again, and I just want to come around, circle back, and underscore the importance of child care emergency planning and why it is so important. Again, planning minimizes the likelihood of injuries and death of children who are particularly vulnerable. The preparation can minimize the psychological impact and trauma, and I think this is something that we really learned a lot about over the last several large disasters, and that's why we're having a separate entire webinar on this. That will be the number 6 webinar. We also want to underscore the importance of planning and preparation for the providers themselves, because we want to reduce any revenue that they lose to ensure that primarily they can have continuity of care for our children. And then finally, child care, once again, is a truly vital service. We have seen time and time again that the speed at which child care is able to recover really indicates the speed of the overall recovery of the entire community. So now we're going to do a poll, and our second poll asks, which of the following has your state completed for the state emergency preparedness plan for child care? We want to know, and we want you to select as many as you'd like, but this really reviews and points back to the framework that Amy just described, and we're interested in knowing, if you've said that you have a comprehensive plan, does it really cover all the bases? So does it cover planning for continuation of services to CCDF families? Does it coordinate with the emergency management agencies and other key partners? Does it have regulatory requirements and provide technical assistance to child care providers? Does it cover provision of temporary child care services after a disaster? Does it talk about rebuilding child care after a disaster, or none, possibly? So let's take a look and see what we've got here. But about 30% of you have actually planned for continuation of services. 44% of you have coordinated with other agencies. That's good. As I tell people, even if you don't have a plan, reach out now to the people you're going to need to deal with later, because those relationships are absolutely key when an emergency arises. About half of you have developed regulatory requirements and are providing technical assistance for child care providers as part of your plan. And then a very small number have worked on provision of temporary child care services after a disaster and rebuilding. And quite a large number of you have either not completed any parts of this kind of plan building or only partially completed. So we know we've got our work cut out for us. Okay, this is going to be made larger on the screen, but this is a tool that we have created at the Child Care State System Specialist Network to help states determine who are the folks that should be at the table. And this list is probably larger than any state would use, but we tried to put in as many of the possibilities as we could so that you could at least take a look at this and see, gee, is this someone that we should be inviting to the table? It includes at the very top tribal entities, and I wanted to alert you that the Stafford Act, which governs the federal government's disaster relief and emergency assistance program, was recently amended to promote recognition of sovereignty and allow federally recognized tribal governments to make requests directly to the President for a major disaster declaration without having to go through state government. And as a consequence, it will require greater coordination between states and tribes when disasters occur on land that may impact both the state as well as the tribe. I've listed there the ACF Regional Emergency Management Specialists. These are wonderful resources within ACF available to assist, and we'll be hearing later from one of them from Washington State. We have included FEMA, SBA, other state offices of emergency management, and your state, it may be called something else. Some places call it civil defense, homeland security, emergency management. There are a whole range of names for these agencies. We've got early learning advisory councils, state licensing agencies, and if we move on to the next slide, we've got a whole array of other state agencies that you might want to invite to the table, state or local law enforcement, and then local emergency agencies or associations of those agencies. And then we move to a different category, which is the non-governmental agency category. And this would include child care R&Rs, voluntary organizations active in disasters called VOADs, child advocacy organizations, and then we move on to other statewide entities that you might want to invite to the table that could help you in considering what should be done at your state level. I want to highlight the very last item there, representatives from non-English language speaking communities. It's going to be critical that you can communicate what you need to communicate to the field, whether it's providers or parents, in languages that people can understand in emergencies. So it's critically important to have means of reaching those populations, and it's important to have representation on your committee. Okay, we're going to move back and move over to Washington State, which is going to be presenting. We have with us both Louisa Swanson and Sally Regal. Louisa Swanson serves as the Regional Emergency Management Specialist for the Administration of Children and Families in Region 10, an agency of the U.S. Department of Health and Human Services. Louisa has a master's degree in public affairs from the University of Minnesota Hubert Humphrey Institute of Public Policy in Minneapolis, and she's worked for ACF for 10 years and participated in disaster response in Iowa flooding, Hurricane Dean, Hurricanes Gustav and Ike, the 2008 presidential inauguration, and list goes on and on. In her current position, she works with states, tribes, and other jurisdictions and community organizations in Alaska, Idaho, Oregon, and Washington to build preparedness and response. Sally Regal has over 25 years of experience in the child care field. She began her career working in child care R&R, and she's worked for Children's Administration, managing programs and developing policy in the Office of Child Care Policy and the Division of Child Care and Early Learning. And she is currently an Administrative Regulations Analyst at the Department of Early Learning in Olympia, Washington. So I'm going to turn it over to Louisa and Sally to talk to you about the amazing inclusive process that Washington State has used for planning its comprehensive emergency preparedness and response plan.
Great. Thank you so much, Abby. And thank you, everyone who's joined the call. It's always great to see a lot of energy around this, and we know that the more people hear this and the more people work on the planning, the better and easier, frankly, my job is going to be when there is a disaster. I did want to just take a moment to remind everyone to enter your questions. You want to send those questions. I think there's a Q&A pod at the center of your screen. So please do that, and we'll just go forward with this. So I'm going to okay, great. So some Washington demographics. The total population in the state is just over 6.5 million, with substantial numbers of children you see in there. And the average monthly number of children served by CCDF is 44,800. So some of the first steps we took on this was Office of Child Care, the federal office, encourages the emergency planning for child care, and I know Amy got a chance to talk to you about that. Since 2007, we've really been in discussions with Department of Early Learning, but they really needed help getting started, and Department of Early Learning is where our CCDF funds, our administrator is, and where our funds are. So really we were working closely with them. We worked really collaboratively as both the state and Region 10 to join resources and talk about how to move forward. And some of the reasons for this that really got people finally around the table was the kids' task forces that were started, for instance, in Joplin in 2010 after their tornado, and certainly with New York and New Jersey, especially around Hurricane Sandy. We saw that there was just a push for information after disaster from child care. So really that was a motivating factor. And we also realized we really needed input and discussion from both agencies, both the licensing agency and the subsidy agency. And I realized that that might be different depending on which state you're in. But in our state, the Department of Early Learning does the licensing, and Department of Social and Health Services does the subsidy portion. So it was really important that we figured out how to engage both agencies on this. So who's included in the plan? Because this is a very comprehensive plan, but at the same time, we really needed to define who was included in this. So the families who received state child care subsidy are included. Licensed child care providers are included. The Early Childhood Education and Assistance Program, ECAP, in state of Washington, which is a pre-K program, and also homeless child care program contractors and their families. The plan does not include Head Start and Early Head Start programs. We talked about that possibly being added later, but really wanted to make sure that we made it clear who was involved in this plan, or who's included. some of the resources we used, North Carolina had a plan. We really used that as a template, and that was really helpful. You'll learn in the lessons learned that it was really helpful, but we also had to make it our own. And also OCC, Training and Technical Assistance Contractor, that we had provided also nationally identified resources. There was also a really good document that came out called Superstorm Sandy Lessons Learned, and that might even be something that you all have seen. If you haven't, it's a really good document that I think does help moving forward with the planning process, and probably Abby can share that. Also, OCC staff and the regional emergency management specialists worked together to bring the right people to create the plan. We needed a work group, but we needed it to be a useful work group, which meant not too big, but we also needed to make sure we had the right people who had access to the senior leadership who would be saying yay or nay. We also had discussions with New York and New Jersey, and that was really helpful because they definitely have had so many lessons learned from Sandy, so we really worked with them on that. All of their input was super helpful. The committee, the first time we met, this has been a labor of love. It's been like we've had, we're building a family here. It's been so long. But our first meeting was in November 2012, and the Child Care Emergency Preparedness Committee, the group included the CCDF Child Care Administrator, the statewide licensing supervisor for Department of Early Learning, the regional licensing supervisor for Department of Early Learning, the payment system manager, who's with Department of Social and Health Services, the call center manager, who's also with Department of Social and Health Services, the child care policy liaison for Department of Early Learning and Department of Social and Health Services, the emergency manager within Department of Social and Health Services, Child Care Aware Office, which was our Child Care Resource and Referral Agency, the Office of Child Care Program Specialist, and me. And at the time as well, we also had Jenny Holliday working on this, who is also a REMS. And just, we did not, you will see in this though, and I just wanted to point this out, we did not actually include the EMD, Emergency Management Division, within the state of Washington as part of the committee, although they have been involved with this planning effort just at some different points. So, and there are specific points when I think it's good to engage them, but, and they certainly will have a copy of this plan once it's done. And I think now we're going to go to Sally.
Okay, thanks. I want to say for the last slide too, we started this, that says here in 2012, and we thought it would be a quick process that we'd just be done in a few months, and we're still working on it. It's a very big project, but without our help from Louisa and our other federal partners, I'm not sure we would be even this far. But so skills and ability for the group, we needed people who knew at least a little bit about most everything we were talking about. And like she said, we had mid-level people from both agencies who could talk directly to senior level managers so that we could kind of work it out between us and then be able to quickly put questions forward to other people. And people had specialties in licensing and subsidies and the resource and referral, CCA, emergency management, human services, and social services. So we got together a group that was, like Lisa said, small, but people who knew the subject pretty well. The group, having this meeting provided a forum for both agencies and our partners to all sit down together and talk and get to know each other. One of the good things was as many of us had worked together before, so we did know each other. And like was said previously, these relationships are very important. And it took a lot of processing at first. We didn't really know quite where to start. We knew what we wanted to come out with, but we didn't realize what to do because it seemed so big. And that's why minutes were so important, because we would talk around and sometimes come up with the same questions we'd answered previously, and we'd go back to our minutes and review them. We divided into subcommittees, a licensing subcommittee, subsidy subcommittee, and a communications subcommittee. And this was very helpful because we did a lot of committee work outside of the main meeting and then brought our information back, which saved a lot of time because the whole group wasn't discussing everything. The plan, this is actually a child care plan. It's about child care, not our COOP plan. And it is in child care language. One thing we realized early on is that we spoke emergency language as a different language than child care language. And one of the first things we did was make an acronym definition page so that we could all kind of know what we were talking about. And this is our state plan, although our federal partners helped us so much on this. And it was divided into 3 sections: preparedness, response, and recovery. And each one of our subcommittees, the licensing, subsidies, and communications, each looked at those 3 sections. Okay, so the key activities, was to support the health and safety of children through licensing. We have a lot of licensing rules, and we want to keep everybody as close to those as possible during an emergency. And continue child care subsidy payments. We worked a lot with the subsidy part of the program. Department of Early Learning has the policy for subsidies, but the subsidies are actually authorized through the Department of Social and Health Services. So we have to have good communication with people, and we want to keep authorizations going, and we have some in-home relative provider care that we wanted to keep going. So with that, we talked a lot about working cross-state. Our state is divided by mountain range, so we have totally different disasters on each side. So if one side was wiped out, the other side could help by phone or coming over. And there's also, we have some mobile offices that can go out for authorizations and eligibility. Okay, and one of the things that we wanted to do is disseminate information to providers and families regarding the disaster. And this was good because we worked closely with our child care CCA, and the Resource and Referral. And we work closely with ESF 6, which is Emergency Support Function 6. And our partners from like Child Care Aware and the Red Cross and others across the state, it's so important to have the support from those groups and to get to know those people. So the state cannot do this by themselves, and we'll need to call on our partners when this happens, if we have a disaster. Okay, and I think, Louisa, that's over to you now.
Great. So some of the assumptions that we had with this is that child care is an integral and essential part of a community's coming back after a disaster. So we knew that we wanted to make sure it was very articulated well that we know child care is important. We also assume that licensed providers have some emergency plans in place to have enough food, water, and supplies to take care of the children for up to 3 days. We also believe that Child Care Aware plays an integral role in providing timely information to providers, parents, and communities. And last of all, we also assumed that this disaster is manageable since we do live in a possible huge earthquake zone. We didn't want to get overwhelmed and we needed the disaster to be something that is the most likely disaster that we would deal with, like a severe snowstorm or something like that, not a major Cascadia subduction zone earthquake. And ACF's role, we helped convene the group. We helped facilitate some of the cross-department and cross-discipline understanding, especially between child care and emergency. And we also helped support the plan process and development and just continue to help moving the planning process forward. We also provided national resources and best practices, and we also really wanted to share the plan with others, and we'll be able to do that when it does become finalized. Some of the questions for states to consider that we kind of learned during this is, does senior management support the creation of a plan, including designating staff? This really does take some time, and there really has to be that commitment on part of senior management. Also, what agencies need to be involved in the development of the plan? Like Sally said, this really is you really need to know all the players and have everyone contribute. And finally, can the state form or fund a contractor or devote staff to write and compile the plan? Because that's really not ACF's role, so just want to make sure that the state has that ability to do that, because it will take some time and work. Other considerations for states is, what is their role in providing emergency respite temporary child care? And that was we had a lot of discussions around that, because that kind of happens when there's a disaster situation, that you have other agencies coming in, such as Save the Children or Children's Disaster Services through the Church of the Brethren, coming in to provide some respite and temporary child care. So what is the role with that licensing agency in terms of supporting that? Also, will they consider expanding subsidy eligibility in a large-scale disaster, or is that appropriate? And how will they help child care providers? What is it child care providers need, and how will the agencies support child care providers? And finally, what policies are they willing to relax to support families, such as verification requirements, work requirements, etc.? So that's something to consider when you're creating your plan. We had a lot of great lessons learned from this. First, every state organization and system are different, and to be meaningful, the plan must get into the details. That was, in part, that's how we had in North Carolina our plan. The plan needs to be read and understood by department staff and emergency management. So, for instance, we have one component in ours is we have an overview of the child care, the way child care works in the state of Washington. And DEL said, well, do we really need that? But we really did, because we need emergency management to be able to understand what's going on and what they do. Also, in order to put a real plan together, the committee participants must think beyond their own department and specialty. So that means they really have to be flexible and really have to think through what they can do. Also, as I've kind of referred to this, we really had to make the plan our own. We had to un-North Carolina it. As much as North Carolina had a great template for us to work from, we really needed to make it our own. And it would have been helpful to bring in a contractor midway through to help write the plan. They also would have provided some fresh perspective. And just, I know we've said this a lot, but it really was a long process with a very committed group. And next steps, we just need to finalize the plan and have it distributed to upper management. It actually has been distributed to upper senior level management for feedback. So now we need to integrate the feedback and finalize the plan. And then we'll turn it over to Department of Early Learning's finish writers so they can finish it. And I think next, going back to, and then we also have, for it to be reviewed at least annually, because you want to make sure it's a real plan. So next is Sally.
Okay, you can write a great plan, but if you don't have any training, no one knows what to do. So we have to make sure that this plan gets out to the field, to our licensing staff and the call center staff who actually do the authorizing for child care, to make sure that it's understood. And the Department of Early Learning had planned to do an exercise, a tabletop exercise, to kind of see how this would all work, except for we had a mudslide disaster and everything was kind of put on hold for a while, so we're not making that June deadline. But the good thing is we did use part of our plan during that time with we had everything geo-mapped and knew which providers were in the area and called them and made sure everything was okay with them. So good and bad. Okay, recommendations. You need to bring together the right people, not too many, but the right people that represent the organizations and represent the work that needs to be done. And to do a little pre-work brainstorming before we bring in emergency management. Very important to have a note taker, and like Louisa said, it would be very good to have a contracted person to come in to keep everything on track. Because most people, they don't it's just a small part of their job, and they don't have time to keep it running. And luckily, we had our federal partners who helped us way more than they maybe should have, but it's not really a federal staff job. So I would say hire somebody if it's at all possible. So, and there, Louisa's and mine, email address and phone numbers if you have additional questions, or put your questions through the webinar question, and we'd be happy to answer them.
Okay, this is Abby again, and I really do want to encourage you to use the Q&A pod, and if you do have questions for the presenters or for the Child Care State System Specialist Network, please do use the Q&A pod, since we don't have the ability to elicit your questions verbally and hear them. Please do use that box. Okay, I'm going to move on to the second section of our webinar today that deals with developing protocols. We want to focus on some of the important things that need to happen between the state agency and all the other players, and also some of the things that need to be done before a disaster and some of the things that need to be done after a disaster. First, we want to talk about geo-mapping, and New York is going to share quite a bit of information that I hope will be very useful to you about geo-mapping. In the aftermath of Katrina, Mississippi licensing staff found that they literally didn't know where to find the providers. They no longer had the landmarks, the buildings, the road signs, anything that they had used in the past to be able to locate where their providers were supposed to be. So this GIS mapping becomes very important. With respect to communications, it's critically important to have thought ahead of time about how the agency is going to communicate with other agencies, its own staff, providers, parents, other agencies, as well as being able to communicate in multiple languages and through multiple forms of media. And New York will also talk to us about their communications methods. And finally, when a disaster strikes, the federal government, in its effort to provide assistance, needs information from the disaster site so that they have good information to proceed in terms of what kinds of resources need to be brought to bear. And we'll be talking a little bit, New York will be responding about how they responded during Superstorm Sandy in their effort to report back up to the federal government about the conditions on the ground. I'm going to introduce the speakers from New York. Janice Molnar is the Deputy Commissioner of the Division of Child Care Services in the New York State Office of Children and Family Services, and in that capacity she serves as the CCDF State Administrator. Through her more than 30-year career, which has included working in the public and nonprofit sectors, Dr. Molnar has concentrated on many of the issues affecting children and youth. And then Dan Tatro is the OCFS GIS Program Manager at the New York State Office of Information Technology Services. And in this role, he's been responsible for the strategic direction and operation of OCFS's Enterprise GIS offering. And before joining OCFS in 2005, he has worked in software development, and he has helped MapInfo's largest customers integrate GIS into their business processes. So without further ado, I'm going to turn it to New York.
Thanks, Abby. New York State is the nation's third most populous state after California and Texas. According to the 2012 American Community Survey, New York's population is just over 19.5 million people, with close to 3 million children ages birth through age 12, which would be our potential child care universe if children and families had no other care options. As it is, we have 21,000 regulated providers with the capacity to serve 708,000 children. With over $800 million available for child care subsidies from all sources, in federal fiscal year 2013, we were able to serve approximately 223,000 children. Beginning in 2008, OCFS began serious disaster preparedness planning. This was kicked off by exercises conducted in cooperation with counties about what to do in the event of a nuclear power plant disaster. We currently conduct those exercises quarterly. As you can see from the list on the slide, our work was multifaceted. Little did we know the extent to which this work would pay off. Of particular importance to our response to Superstorm Sandy was increasing utilization of geographical information systems data, which Dan Tatro, our GIS program manager, will now describe in more detail.
Thanks, Janice. The GIS team here at OCFS is responsible for supporting all geographic and demographic needs of the agency. That term, geographic and demographic needs, is pretty broad and encompasses things like emergency response, and all the way to something like demographic analysis for grant proposals. We're active in the child care, child welfare, juvenile justice program areas, among others. I want to just make a special note to keep in mind the team size as we progress through the next few slides. The functionality that you'll see is pretty impressive, and we're able to deliver with a very small team. You know, team is a term I use loosely. It's one full-time employee with additional resources as necessary. And we're able to do this basically by system design and preparedness. A couple of terms and definitions before I go any further. Address validation and geocoding allow us basically to associate an address to a geographic location. Address validation is the process of, cleansing an address according to the USPS. So that means if, you have an application, business application, and you're managing child care providers, the provider gives you an address that has a street and a city. These tools will cleanse it, standardize it according to the USPS, append a zip code and even the zip 4 that you see on your envelopes, and make sure that we have the best information as possible. Geocoding is the next process that associates a latitude longitude to that location. We see that functionality pretty regularly. OCFS began validating and geocoding in 2005 as a means to automate caseworker assignments. So if we had a phone call come in, we would know exactly where an address was. If it's in a county, on a Native American Indian reservation, or in New York City, we would be able to tell exactly what caseworker should be assigned to that case automatically. It eliminated a huge manual process for us. Now we've carried that out. Nearly every application at OCFS performs the same process, and it really helps us make sure that we have really clean address and location information. We processed 3.5 million addresses. I would call it transactionally, somebody with fingers on their keyboard per year, and I would say that our data warehouse maintains about 25 million addresses. So we have a huge collection, if you will, of address information. The most important thing to take away here is that we're cleansing our addresses before they go into the system, so that if you have somebody on the phone, with a child care provider or, whatever else the situation may be, you can prompt them for information like, are you sure that the zip code is correct? Or this looks like a multi-unit building, maybe it's an apartment building, do you have an apartment number for that unit? These are the types of things that the software delivers that are very important. In the case of child care, we're cleansing the addresses when a registration is created or when an address is updated.
Okay, we're going to make this larger so you can see. Go ahead, Dan.
Yeah, this is this is getting down to the nitty-gritty, and really what I wanted to show here is, this isn't some magical, some magical thing that just happens. We're actually appending a latitude and longitude to these records, and this is what it takes to perform geographic queries or spatial queries, as we call them. And what that means is, given a set of points or given a set of providers, what political boundary are they in? Senate, congressional, assembly, maybe administrative boundaries, counties, or county subdivisions, or even school districts, or other things like how far are these locations from other locations. Let's find the nearest child care provider. Okay, so during emergency situations, GIS allows us to, the slide says, accurately identify the critical programs and populations, but I think it's almost more importantly that we accurately identify them and we do it quickly. In an emergency, we're dealing with something called an area of operation, and when we need to respond pretty quickly. We use a combination of desktop and server-based software from Pitney Bowes, which is formerly MapInfo. And having that good, clean information in our systems, lets us respond, and so that we don't have to process any addresses, really when the emergency is happening. Most of the time, we're identifying resources or child care providers around a location of interest. So that would be the first three emergencies that I noted. We had an active shooter situation, a plane crash, or building explosion. What we're working with there is a location of interest, and then we normally would look out from there a certain radius. So we're we're looking out 1 mile from this particular event. Flooding, especially Superstorm Sandy, is another is a real challenge, just given the sheer size of the affected area.
Okay, we're going to make that larger for you as well.
Okay. Given the amount of the population that we serve, we really need to project the impact of the storm on our providers. So prior to landfall, we were able to identify child care providers within the projected storm paths. These projections came from NOAA, and we actually really had three main projections we were working with. The first, when we were further out, it was projected to break landfall a little further south and then travel, up through the Buffalo area. The second was, believe it or not, switched gears. It looked like it was going to go out further out to Montauk Point, which is the eastern tip of Long Island, and go through Boston. But of course, it's worst case scenario. The storm comes further north, it hits New Jersey, and basically the surge is what caused most of the catastrophe in New York. Now that we're concentrating on New York City, we're doing some risk assessment there. An important note is that New York City and Long Island make up about 60% of our child care providers in the state, and that's 12,000 out of 21,000. So we really had to make sure we knew exactly where our most at-risk providers were. So this map is Staten Island, and it really shows off how dense some of these provider areas can be. The other boroughs are so full of these map pins that you can barely see the ground. The information here that we use to identify hurricane evacuation zones came from our State Emergency Management Office, New York City, and Nassau and Suffolk counties. in some of the hardest hit areas, like the Rockaways and Long Beach, which for those who don't know is the very southern border of Brooklyn and Queens, we really need by 344 providers at about 11,000 total child capacity. So this is an example of how we use GIS to get local. And at this point, I'll turn it over to Janice Molnar, Deputy Commissioner, Division of Child Care Services.
Thanks, Dan. So picking up where Dan left off, this is the kind of document in the previous slide that guided priority setting for field staff site visit inspections. If you can note the column in the far right, it's difficult to read, but that indicates water depth, 5 feet, 6 feet, 7 feet, 8 feet. Notwithstanding the fact that the offices and roads were closed and the homes of many of our staff and that of the New York City Department of Health and Mental Hygiene were also flooded and without power, within 3 days after the storm, we had staff in the field reaching out to providers and assessing damage. Without phones or internet or even mail service, contact had to be in person. Needless to say, focused and scheduled communication was key to OCFS's disaster recovery response. As Dan noted, my agency is not only the CCDF grantee and primary regulator of child care in New York State, but it is also responsible for child welfare and juvenile justice, including directly managing juvenile justice facilities that would need to be evacuated with all the details that would entail. 7 days a week, starting on the Friday before the storm hit, which was a Monday, we had one, sometimes two strategy meetings of OCFS senior staff. The agenda, sharing critical information, and mobilizing resources. The storm, as I say, hit on Monday afternoon. On Sunday, the day before, we had the first of what became daily calls with the county commissioners. On the phone were staff from the governor's office and executive staff from our agency, OCFS, and our sister agencies. The agenda, what do the counties need and how can we help? New York is a state-supervised, county-administered state, which means that counties have a considerable amount of autonomy in determining how they run their child care subsidy systems, among other social services. They lay out their approach in annual child and family services plans, which are fairly extensive and take time both to produce and to review. Plans can be amended, but the amendment process can be lengthy as well. Clearly, there was no time for that. So we created a simple checklist with the items that you see here that counties could submit by email or by phone, since many couldn't access their offices or computers, and we would approve on the spot. This process was operational by November 6th, barely a week after the storm. This
make that
even,
larger.
if it's enlarged, will be hard to read, but contact with providers was by telephone or in person, depending on conditions. Especially considering the children's homes were as heavily impacted as their child care settings, we put a premium on maintaining continuity of care, even in settings without electricity, heat, or running water, which in normal circumstances would lead to program suspension. Basically, we waived everything that could safely be waived, including on a case-by-case determination, group size, and staff-child ratio. Our guiding principle here, maximizing regulatory flexibility so as to serve families who needed child care and to help keep child care businesses open while not straying from our core mission as a regulatory agency, which is to protect children and keep them safe. So this is an example of the checklist we used. Granted, internet connections were not easy to come by, but for those who could access one, we posted what we hoped would be useful information. Our first postings were 4 days after the storm. We refined and added on a daily basis. This screenshot is from November 8th. We drew heavily upon federal resources, especially those produced by FEMA and the Substance Abuse and Mental Health Services Administration, SAMHSA, as well as those produced by experts in child development and resiliency. Whenever we could, we posted resources in both English and Spanish that I think you can see here. In addition, within 3 days after the storm hit, we made hard copy fact sheets available to both families and providers who visited the disaster recovery centers set up by the state. And as time passed and federal resources were being made available, we wrote to our child care providers telling them how they might avail themselves of these resources. This letter from December 2012 includes links to information about FEMA disaster assistance and disaster loans available through the Small Business Administration, along with registration information for an audio conference about facility cleanup that was presented by the Office of Child Care and the Environmental Protection Agency later that month. Our Region 2 oversight jumped into action right away, even though they too were affected by the storm, given that the Region 2 office is located in New York City. Phone calls started right away, as did written reporting. Daily reporting transitioned to twice a week through January of 2013 and less frequently through March. What OCC wanted to know was the number of closed programs and the number of children affected. This was intended to help OCC and ACF make the case to Congress that resources were needed to help with relief and rebuilding, and in that they were successful. I must admit, however, that it wasn't easy to update and provide on a daily basis, but regular reporting honed our data collection capacity and helped us see in real time the evolving capacities of programs to serve families and children. Meanwhile, the Region 2 office, under the leadership of the Region 2 Administrator, Joyce Thomas, reached out to OCFS to activate a time-limited, task-oriented group to identify and address short, intermediate, and long-term recovery challenges and solutions impacting children. The first meeting of the Children's Issues Task Force was on November 30th. It built off of an information-sharing meeting held 2 weeks earlier among state representatives and a number of nonprofit organizations, all of which were hungry for information and resources. Most of them became task force members. Over the course of a year, the task force involved 115 representatives from 30 different federal, state, and local stakeholder agencies, both governmental and non-governmental. Meetings were conducted via conference call. Between 30 and 37 individuals participated in each call. In addition to a core group of participants, guest speakers shared their perspectives and expertise on a variety of relevant issues focused on identifying and addressing storm-related recovery needs. The task force shared information, but it also strategized around interventions. It met weekly through mid-January and then transitioned to bi-weekly and then monthly through December 2013. The task force disbanded 6 months ago. The work, however, continues, with funds from the Supplemental Social Services Block Grant and other resources, both financial and otherwise. Thank you for the opportunity to share some of our work.
And there you will find the New York State contact information, both for Janice, who just completed speaking, and also for Dan Tatro, who is responsible for their GIS functions. I want to identify for you the Emergency Preparedness and Response resources that are already up on the website. OCC has resources, and the link is listed there. In addition, CCTAN has a number of resources, and I want to mention that the tool that I described earlier on in the webinar, which has a listing of all the possible entities that you might want to invite to the table, is also can also be found on the CCTAN EPR page. So the link is listed there. I also want to mention that that tool has hyperlinks, so that if you go, for example, to the the Regional Emergency Management Specialist, you can click on that and you can actually find the directory of who that contact person is for each region. And it is similar. There's tribal grantees, a whole range of different things where there are hyperlinks wherever we could find them to the listing nationwide of who that person might be that you need to reach out to. In terms of next steps, this webinar obviously focused primarily on bringing the other players to the table and figuring out how the communication will occur in a variety of different respects. Our second webinar, which is coming up very shortly, coming up in July, will focus on subsidy issues. We want to focus on the very things that the framework that OCC developed highlights. So we will be focusing on policy options when responding to an emergency. So these are things like what are absence days for the providers when there's an emergency? Do you, for example, delay redetermination? What kinds of documentation might be needed for redetermination? If you have contractors, do you extend timelines on their performance in terms of what are the requirements for how soon they need to contact clients? The second area is continuation of subsidy operations. How are you going to continue the operations of your program in both impacted and unaffected areas? Do you have to shift staffing, for example, over to the impacted area, and how will you do that? There also needs to be a look at services for the impacted families. What are your policy options for creating eligibility for families that newly require the child care subsidy? They didn't necessarily require it in the past, but now that they have no job, they might actually be eligible if there was a job search available to them. What about waiting lists? And then another area would be provider requirements during a disaster. What's the responsibility on the provider? Do they have to report to a licensing agency or report to the subsidy agency that they are having difficulties? If your pop-up blocker allows it, a SurveyMonkey evaluation will open in your internet browser immediately following this webinar. If your internet settings do not allow it, don't worry. The link to the survey will also be sent to you in a follow-up email. I want to conclude our webinar today by highlighting for you the importance of developing a meaningful, specific, comprehensive emergency preparedness and response plan. We know that it is a complex and time-consuming undertaking involving the engagement and commitment of numerous stakeholders. But the important thing is to not get paralyzed, but to get started. You can chunk up the work and accomplish something, and something in this area is way better than nothing. We hope that we can work with you over the course of the next several months to move all the states forward and to ensure that you have a comprehensive child care emergency preparedness and response plan that can help your state, the providers, and the parents that depend on child care in your state. The next webinar on subsidy will be July 14th at 3:30 Eastern Time. We thank you for your participation and to our speakers for their willingness to share their process and progress. Information about how to register and to join the next webinar will be sent to you via email shortly. We also will be providing additional information coming off of this webinar. That would include answers to questions that have been submitted to us, as well as other materials and links to those materials that we feel would be helpful and would support our discussion here today around the Emergency Management Agency coordination and coordination with other stakeholders. So I really want to thank you all for participating, and we look forward to seeing you in webinar number 2. Thank you and goodbye.